Over 1 million children lost a parent to COVID, including 1.1 lakh in India. In India, an estimated 1.19 lakh children lost a primary caregiver, one or both parents or one or both custodial grandparents. Among them, 1.16 lakh lost one or both parents. The COVID-19 pandemic has resulted in an estimated 1.5 million 15 lakh children facing the loss of a parent or a caregiver, a grandparent or other older relative in their home, including over a million who lost one or both parents, according to a global study to be published in The Lancet on Wednesday. In India, an estimated 1.19 lakh children lost a primary caregiver, one or both parents or one or both custodial grandparents. Among them, 1.16 lakh lost one or both parents. The global numbers. Globally, from March 1, 2020 to April 30, 2021, the study estimates that 11.34 lakh children lost a primary caregiver, at least one parent or custodial grandparent, including other co-residing grandparents or other older relatives. The total is 15.62 lakh children, of whom over 1 million 10.42 lakh lost one or both parents. Up to 5 times more children lost their fathers than lost their mothers. For every 2 COVID-19 deaths worldwide, one child is left behind to face the death of a parent or caregiver. By April 30, 2021, these 1.5 million children had become the tragic overlooked consequences of the 3 million COVID-19 deaths worldwide, said Dr. Susan Hills, one of the lead authors from the US Center for Diseases Control and Prevention COVID-19 response team. Children in India elsewhere. The estimates for India indicates an 8.5-fold increase in the numbers of children newly orphaned in April 2021 compared to March. Study authors told the Indian Express by email that the increase was influenced by the death rates in April. Mexico 1.41 lakh and Brazil 1.30 lakh have the highest number of children who have lost a primary caregiver, followed by India. The US is another country where over a lakh children have lost a primary caregiver. Methodology. The study was conducted by researchers from the CDC COVID-19 response team, Imperial College London, University of Oxford, the World Health Organization and others. It covered 21 countries that accounted for nearly 77% of global COVID-19 deaths as of April 30, 2021. Researchers estimated figures based on COVID-19 mortality data from March 20 through April 2021 and national fertility statistics. They extrapolated their findings to produce global estimates. Loss of both parents was accounted for so that children were not counted twice. The way forward: we need to vaccinate caregivers of children, especially grandparents, caregivers, and we need to respond fast because every 12 seconds a child loses their caregiver to COVID-19, said Professor Louis Glover of Oxford University and the University of Cape Town, one of the study authors. Dr. Seth Flaxman and Imperial College, one of the lead authors, said the hidden pandemic of orphanhood is a global emergency and we can ill afford to wait until tomorrow to act. We urgently need to identify the children behind these numbers and strengthen monitoring systems so that every child can be given the support they need to thrive. Bentley D. Souza, senior faculty at Tata Institute of Social Sciences in Mumbai, who was not part of the study, stressed an urgent need to set up special task force at state and district levels to look into various dimensions, including the vulnerabilities of these children may face, like psychosocial risk and developmental delays. There is no clear policy on these issues, D. Souza said. Thank you.